Hello, my name is Dr. Girish Nelivigi. I am a urologist with 20 years of post-qualification experience. Prostate enlargement is a result of the aging process in the male. As the male becomes older, the prostate enlarges in size. It is a matter of the quantum of enlargement in size. In some people it is more, in some it is less. However, it is a physiological process, and as long as the male hormones are in play, it cannot be stopped. The enlargement is a natural process. The diagnosis of BPH or enlarged prostate is done by three ways. One, the patient himself comes to the doctor or the urologist saying, "Doctor, I have got difficulty in passing urine. I have to pass urine using force, or when I pass urine it comes out in drops, or I have to get up very frequently in the night to pass urine, or I am never satisfied. Whenever I pass urine, I have to go back to the toilet and pass urine, or even after passing urine I feel some amount of urine is left in the prostate." That's how the patient comes to the doctor. And in an elderly patient, that is above the age of say 55 or 60, the diagnosis is very evident that it is enlarged prostate. Next, the urologist does a physical examination on the patient, in which he inserts a finger in the rectum of the patient to palpate the prostate. So he can make out whether the prostate is enlarged or not. The next thing that the urologist does is to carry out some basic tests like urine examination, ultrasound of the abdomen including prostate, and doing a blood test called serum PSA. These help in making a diagnosis as to whether there is urine infection and whether there is enlargement of the prostate and whether there is a cancer of the prostate. For example, a urine examination, that is a culture or a routine examination, will help in making a diagnosis of urinary tract infection. Ultrasound of the prostate helps in making a diagnosis whether there is enlargement of the prostate or not. And second thing is to quantify the enlargement of the prostate in terms of grams or cc. It also gives an information about what changes have taken place in the urinary bladder because of the enlargement of the prostate, and also if there are any changes that have taken place in the kidneys because of the chronic blockage to the passage of urine. A third and an important test that a urologist orders in an elderly person who comes with enlarged prostate is a test called serum PSA. PSA stands for prostate specific antigen. It is a blood test which tests for a special protein which is secreted by enlarged prostate to an extent, but more commonly by a cancerous prostate. So this test is recommended for all males above the age of 55. It is done once a year, and any increase in serum PSA levels they only indicate, mind you, but they do not diagnose. They indicate that the patient could have cancer of the prostate. Once there is an elevation of serum PSA and the urologist is convinced that it is not because of infection, then he may advise the patient to undergo biopsy of the prostate gland. The biopsy of the prostate gland is done by using a special needle through the rectal route. This is done under local anesthesia, and this can be done in about 10 to 15 minutes using ultrasound as a guidance. A special needle is inserted into the prostate through the rectum, and multiple cores of prostate, each measuring about 1 to 1.5 centimeters in length and a millimeter in thickness, are removed, and these are sent for examination. The pathologist examines and gives an opinion as to whether there is prostate cancer, whether there is only benign prostatic enlargement, or whether there is some infection of the prostate called prostatitis.